Good morning. Let's talk blood tests. So, I'm in big support of preventative healthcare, and a simple way that we can do this is by having our blood tests done regularly. For athletes, maybe every 3 months, and for us normal people, maybe every 6 months or at least once a year to get a full bloods done. Now, this is easier said than done. You would think that as a paying customer for a doctor's surgery, that you should be able to go in and ask for the service of having your blood tests done. In reality, we are still spoken down to by many doctors about what we need and what we can access instead of us being able to be intuitive and instinctive and proactive with our health. I'm seeing patients still have a really hard time accessing standard blood tests, important markers, and sometimes being told no. So today I can no longer get my B12 checked. I tend to run on the very low normal, and I have a raised MCV, which means that I have some challenge going on. It's not related to iron, but unless I have anemia, I'm not allowed anymore to get my B12 done. That's the health service executive trying to save money. Now, B12 is a nutrient that can be deficient quite often, especially people on restricted or vegan diets. The way a blood test is reported is that if you're outside of that, I think it's a standard deviation of 2, you're classified as either deficient or over. But that takes that's massive, that variance. And it's being deficient and having symptoms, which for B12 can be quite serious, is very different to being optimally healthy. But medicine and blood tests aren't about optimal health. They're about pathology and sickness. So if you're someone who really wants to be proactive with your health, you can see the challenge. You're going in, you're asking to check on things so that you can keep on top of them, and you're being told no. So then what are we left with? There are a few companies in Ireland that do direct-to-consumer blood tests. They're very expensive. I used to use a company in England, Forth, or their athlete section was For the Edge, and they provided a really comprehensive range of blood tests. They're fantastic. Since Brexit, this is no longer possible because of shipping regulations. So that affordable service where you were getting a very comprehensive blood panel was about 120 euro, I believe. That's not available to us in Ireland anymore. We do have companies like Let's Get Checked, but they're doing the bare minimum. You'll either get a little bit of an iron profile done or a B12 profile done, but the price of that is like 50 to 100 euro for those single markers, and you can't get what we may want, which is a complete white blood cell count, a complete red blood cell count, ferritin, B12, vitamin D. Shoot, I never asked for my vitamin D this morning, which is also really important. We want a thyroid function test, which the thyroid function test is the bare minimal. People can still have thyroid challenges and they're not going to get picked up because they're not looking at thyroid immune antibodies or reverse T3. But still, it's a start. Liver function, which can be really helpful, not to show pathology, but to show challenge. Yes, it will show when there's an awful lot going on. It will show pathology, but just getting an idea of liver function, if it's off, it can tell me a lot about what's going on. Getting your fasting blood fats done is going to be really helpful. Often, if cholesterols are raised, there's a challenge with the liver, or there's a challenge with the gallbladder or the gut, which we can work on and make improvements there. So, a basic blood test can tell us a lot. However, my experience of late, personally and within my family, is a completely incompetent medical system. my dad is sick for the last 2 weeks, and no one is, they're looking at tests that are saying nothing is wrong, while he has enormous symptoms and saying there's nothing wrong with you and sending you home. And then his doctor is good. His doctor is now off sick, so now we're left without his doctor, is saying this isn't good enough. I'm like, no, this is not good enough. We've gone and ordered all of our own tests. But patients shouldn't have to do that. Doctors are no longer looking at patients and how healthy patients are. I mean, simple stuff. Look at the patient. Look at their body shape. Look at their hair, skin, nails. Look at their vitality. What does the patient smell like? Yes. Our body scent? Our body scent and everything about us physically. This is what doctors did before. We had all the fancy tests. But fancy tests don't pick up everything about a patient's health. So tests are information. They're not conclusive. If someone isn't well, someone isn't well. And we need to keep digging and finding what that problem is. So on the one side of it, we're failing our patients. There's a backlog of a need for tests, and the tests are only part of the picture. In Ireland, test results are flying everywhere and going nowhere. And the patients are not getting listened to when they're still having problems. It's like, oh, your test is fine, you're dismissed. Or, oh, your test shows this, take a drug. But we're not getting to the root cause of anything anymore. The stress levels are through the roof for people. You only need to leave your front door to watch how drivers are driving, how people are on the edge with anxiety, rushing around, stress, load, and worry. Now, a lot of that is self-created, but the pace of life right now, we're heading into a massive crisis if we don't start taking it back. Our medical system isn't supporting patients, except for the rare doctor, and that rare doctor is suffering from burnout because they care how we should, but in today's world that's too much. Practitioners like myself, we're absolutely burnt out because we're carrying all of that load to try and figure out how can we support this patient when there isn't a medical service there to do it. And then we have patients like myself going in and asking for bloods, and like lots of my other patients getting questioned. You know, I was in there because I haven't been feeling well. I have some sort of viral thing going on and it's impacting my skin. And I just got totally dismissed because my doctor apparently knows more about what's going on for me than me telling her I have something in my system. I know, because I'm a human being, and us humans are built with a system to know when our bodies are okay or when our bodies are not okay. But that's not considered anymore. Instincts and intuition don't matter, it seems, in a world of healthcare. And that doesn't make any sense. And then by getting proactive tests like my DHEA, and this will resonate with another patient of mine recently, I got questions about why am I looking for DHEA. In fact, I'm not 100% sure I'm going to get it, even though it was discussed, because she may have decided that I don't need it because it's not important. But DHEA is the mother compound for our estrogens and androgens as we transition from perimenopause into postmenopause. And being ahead with managing that will help me with symptoms as I transition into postmenopause, and also hopefully prevent a need for using HRT or other being in a problem. And it's just dismissed. But if I go through a good perimenopause and menopause, I'm a productive member of society, basically. Like, we're not thinking. It's driving me nuts for the patients that are trying to do everything. So I don't know what the answer is. Like, I'm one healthcare provider doing my absolute best to support patients through the A to Z of everything that is going on for their health. But I can't order the blood tests or the diagnostics. I haven't got the final say as much as the doctor has. And when patients go back into the doctor's surgery and everything that we've been doing together is dismissed, I often lose that patient because the doctor's like, just take the pill, just get the test done, or there's nothing wrong with you, or this is a permanent diagnosis. So patients are staying sick rather than getting better. Practitioners like myself, we can get you better. Like health, the body's always trying to get back to optimal function once we listen to it, her, him, and support it. So don't give up. We're facing a massive healthcare crisis. So I think we should be demanding more. We should be sacking doctors that aren't actually listening to us or taking care of us. We should be seeking the doctors that do care and are up on top of their CPD and understand things like DHEA and its importance in menopausal intrachronology, if you want to Google it and get up to date. And I can't keep on top of 100% of everything for all of my patients. I need doctors to do that as well. Yes, I'm really lucky. Originally, I'm a pharmacist, so I studied on a medical level. I'm not a doctor. I'm supporting patients as best I can. And there are a lot of practitioners who are, and there's others too that have less good qualifications that are trying to do it but don't know what they're doing. So demand the best and start giving the best to your body. So that's my rant over. But in a nutshell, we all deserve health, feeling good. At the moment, we have to do a lot of it for ourselves. The system isn't there. The system is very, very broken. The system is a sick care system. If you want to be well, you have to do it yourself. That's just the honest truth. We got to change our lifestyles. We got to work on our sleep. We have to manage our stress, learn about how stress impacts the body and how we can deal with it better. We have to move our bodies. That may mean paying a personal trainer or going to the gym or getting outside. We need nature time. We need outside time. It's an absolute necessity that we have good food and good water. That's all down to us. So if you want to go down the route of health, a lot of the work is us and getting empowered and working with a support system. Not the internet, not Instagram. People don't give a shit. So we got to empower ourselves. And often that's working with good practitioners and learning as much as you can from people who have spent decades learning as much as they can. You're not going to get that on Instagram and the internet. This wants to make money. I get about 5 people watching this. Don't know why I make them half the time. But just grab your own health. So your options are healthcare, health, a lot of work, the medical system, sickness care. Which do you want? You know, my blister, that's from digging soil samples last week. So, yeah, think about it. Love you lots. Bye.